Hi, I'm Dr. Wendy Wagner. I'm an OBGYN in Hillsborough, New Jersey, and I decided to make some short videos going over some basic OBGYN concepts for a couple of reasons. One being that we just don't have enough time to discuss and explain everything we'd like to explain between doctors and patients. The other is that there's a lot of misinformation on the internet that I'd like to simplify and explain. My first video is going to be generally about pregnancy, pregnancy testing, the way pregnancy occurs, and how and when to test for pregnancy, and then we'll take it from there. So the first basic thing I'd like to clear up about pregnancy is we don't count pregnancies in months. A pregnancy is 40 weeks, and that pregnancy is from the last menstrual period. So your doctor will often ask you, when was your last menstrual period? And they're asking about the first day of your last period. From the first day of your last period until your due date is 40 weeks. So that's actually 10 months, making pregnancy a little bit longer. So generally about pregnancy, when we talk about a normal menstrual cycle, your last menstrual period to your period, we assume that a normal cycle is 28 days. Now, this isn't always the case. It can be 24 days, it can be 32 days, but what we base all our timing on is a 28-day cycle. So, what happens during this cycle? You have the first day of your period, you have an LH surge, which is just a surge of hormone that triggers ovulation. We'll talk about that a little bit later when we talk about testing for ovulation, timing of ovulation. Just after that, about 24 hours, ovulation occurs. That means the egg is released from the ovary, okay? Now, what happens after the egg is released from the ovary is that when you're trying to get pregnant or when pregnancy occurs, the sperm meets the egg actually in the fallopian tube. So, the sperm swims up to the fallopian tube, the sperm and the egg meet here, and that's when fertilization occurs. So that occurs anywhere from 1 to 2 days following ovulation. So once the sperm and egg meet, the egg is fertilized and this becomes essentially an embryo. It starts to move down into the uterine cavity as it's quickly enlarging from 2 cells to 4 cells to 8 cells to 16 cells. It comes down into here. It takes about 3 days for this to travel from the fallopian tube into the endometrial cavity, which is where the baby's going to grow. 2 to 3 days after that, it actually implants. Okay? So anywhere from 5 to 7 days after this fertilization, okay, it implants in the wall of the uterus. So after that time, there is release of what we call beta HCG from the embryo, which is now larger, into the maternal bloodstream. Now the beta HCG is what we're going to be measuring in the pregnancy test. So how early we can take a pregnancy test depends on when this hormone gets into the maternal bloodstream. Okay? As we can tell, that's very variable. You know, it can take anywhere from 5 to 7 days. You might not ovulate on day 14. You might ovulate on day 12 or day 16. So this is very, very variable. And that's one of the reasons I want to impress upon everybody that it's very, very important not to take a lot of pregnancy tests before the date of a missed period. There's a lot of pregnancy tests out there that say that you can detect a pregnancy 5 days before your missed period. Possible, yes, but a lot of people will do that and they'll get a negative. 5 days later, they'll get a positive. Okay? There's also, aside from ovulation, the egg lasts for 12 to 24 hours, but sperm can last for 5 to 7 days. Okay? So there's a 5 to 7 day window in here that is open depending on when you ovulate. So basically what I'm saying is that this is very variable, and even at the time of your missed period, you may not get a positive test. Okay? I think it's very hard for some people, especially when they're trying to get pregnant or they're trying to not be pregnant, to test prior to the missed period. But it's really important to do that in order to have a successful time at testing. Okay? The other thing that I want to go through is the actual pregnancy test itself. They've done a lot of studies on pregnancy tests, on levels of beta-HCG, which is the hormone that the embryo releases, how much of that is necessary to get a positive test. So they've come out with pregnancy tests that they say that they can detect beta-HCG at about half of the level as the other tests at 25 MIU. They've done testing showing that this isn't always correct, but people want to test as early as possible at some times. I believe that the regular, dollar store pregnancy tests are just as good as any other tests if you test at the time of the missed period, and that's what should be done in order to get the best reading. I've never known anybody who's done one pregnancy test. That being said, there are very few false positives, but most people who do 3 and 4 pregnancy tests will get a number of positives, and it will be very accurate. So now let's go to check out the pregnancy test, and I'll show you what a positive is and what a negative is, and then we'll be all set. Okay, so contrary to popular belief, the urine pregnancy tests at your doctor's office are absolutely no different than the ones that you buy in the store. They all contain these strips, and as you see it says HCG. This is where you dip it in. The ones that you buy at the store are more expensive. They have these fancy cartridges and all of that. Okay, there's 2 different ways that you can do testing. You can do midstream, which means you're going to urinate and you're going to put the strip into the stream. The easier way, I think, is to get a cup, put some urine in a cup, and then you can dip this in the cup. Okay? Now, I'll just show you what to do. You dip it in, leave it for 5 seconds. Okay, and we'll put this one here. So, every pregnancy test has 2 possible lines. Positive or negative, there's always going to be a control line. That means urine has come up and there's going to be 1 single line, positive or negative. 2 lines means pregnant, 1 line means not pregnant. Any pregnancy test that you buy, whether it's 2 lines, whether it's the X, all the ones except the digital that say pregnant or non-pregnant are going to be the same. So basically you can see from this came across here, this is the control line, and this is the test line. So this is a positive test, there's line. So this is a positive test, there's 2 lines, okay? Now you need to definitely let it sit for whatever it says on the box, whether it's 2 or 3 minutes, and we'll take a look at this negative test in a minute. Alright, so you can see that this one clearly only has 1 line, okay? One last thing, and that is when you throw away your pregnancy test, if you take it out of the garbage hours later, it might have what we call an evaporation line, where a really light line comes up in the test spot. So read these right away, and if you read them hours later, then they're not really accurate. Okay? So we have a negative and a positive. So thank you so much for watching. I hope that was informative. Next week I was planning on doing a GYN topic, and probably the most simple and straightforward is the pelvic exam, specifically the first pelvic exam for a girl, along with a pap smear. If you have any questions that you want me to address in any of the videos, or any topics that you think would be helpful to do a video on, then go ahead and email me at info@lifetimeobg.com. Thanks.